Hello, my name is Casey Smith. I'm a student with Maryville University, and I'm here doing my head-to-toe assessment for my assessment class. Today we're working with Heidi Smith. We have had her empty her bladder, and we've had her take off all of her clothes and change into a gown. We also have gotten her height and her weight. We've gotten her vital signs, and we've checked her eyes with the Snellen chart and also checked her near vision with the Rosenbaum chart, and there's no concerns there. At this point, what we would do is we would start by inspecting and then palpating and then use the auscultation to find out any abnormal or normal findings with our patient during our assessment process. We are going to go ahead and look at the patient's scalp. We're going to look at the skull, her bones. We're going to go ahead and look at her hair, make sure that there's no concerns. And then we would start to feel the skull, looking for masses, any tenderness, pain in the facial bones. We can also assess the sinuses, any pain there, any pain here. We go ahead and make sure that the hair is appropriate and the distribution is appropriate and that there's no excessive damage or anything like that that would tell you that there might be some nutritional issues. Let's go ahead and move to the eyes. We would look at the hair distribution of her eyebrows and her eyelashes, making sure that it's symmetrical and that the eyelashes are moving outwards or growing outwards and not back in towards the eye or back into the eyelash where it could potentially cause a problem. We're going to assess her lacrimal apparatus. Okay, and we'll also kind of assess for pain here. We're looking at the sclera for any redness, erythema, any changes, any tenderness that might be inappropriate for a normal exam. At this point, we're going to go ahead and do the cover-uncover test. You're going to have the patient put one hand up, okay, and go ahead and take it down, and then the other hand, okay. And so what we're checking for is any extraocular movements like nystagmus or twitching of the eyes that would be inappropriate, that would tell you that there's something wrong with the cranial nerves with that particular exam. Next, we're going to go ahead and have her follow our pin light. That's what I'm using today. We're going to have check or assess the cardinal fields of gaze. So we're going to go up and down, back to midline, up and down, back to midline. And I need to just watch that as you go in. Great job. Okay. At this point, since we're working with the eyes, we're just going to go ahead and check some facial nerve. And we'll just kind of go through top to bottom, a couple of facial nerves here. Can you scrunch there you go. And then eyes tight. Okay, can you puff out your cheeks? Can you smile? And then stick your tongue out. Okay, great job. And that tells you that she's mad at me, so she's sticking her tongue out. Having her do this for me. Appreciate it. We're going to go ahead and assess her nose, make sure it's midline, and that the symmetry is appropriate as far as the skin as well, that there's no pain in the tissue or the skeletal area as well. We'd go ahead and check to see if there's patency of the nose in both nostrils. Go ahead and put one finger here, go. And the other side, okay. And go ahead and lean your head back just a little bit, okay. We're going to assess the mucosa of the nose. We're checking for hair distribution, making sure that there's no excessive redness in the nasal cavity or the turbinates, and making sure there's no deviation of the septum while we're up there. Let's go ahead and also, I'm going to have you close your eyes. Okay, tell me when you feel this, okay?
Yes. Mm-hmm. Yep. Yes. Yes. Yes.
Okay, great job. Okay, we're also going to assess her ears. We're going to assess the auricle of the ears, making sure that there's no masses or tenderness or lesions on both sides. We're going to go ahead and assess her tympanic membrane. And we're also going to assess the ear canal and make sure that everything is appropriate there. Now, when we use our otoscope, we want to make sure that we're go ahead and pulling the back of the ear to kind of straighten out the canal so that we can get a good assessment of the tympanic membrane and the ear canal. Again, on this side, also using our pinky up against the cheek of the patient or however you use it in the back of the base of the skull area to make sure that we're not hurting the patient. Again, pulling on that ear just a little bit. She does have some build-up cerium, and I say that word terribly, but it's earwax in the ear on the right side. And at this point, we would ask if there's any hearing difficulties. If there are any hearing difficulties. And at some point, there might be some impaction. We need to make sure that gets cleaned out. Make sure that gets cleaned out so the patient can hear appropriately. So we're going to do the hearing test. We're going to do the whisper test. So I'm going to have the patient cover her left ear as I'm back here, and I'm going to whisper a word.
Apple.
Okay, and then we're going to do that again bilaterally. We're going to move to the other side. I'm going to have her cover the other ear.
Orange.
Okay, great job. We're going to do the Weber and the Rhines test. When we would take our tuning fork and we'd smack it on our hands, and we would just have her let us know whether she can feel this bilaterally.
Yes.
Okay. And then again, we would stop it, smack our tuning fork, and then we're going to assess the occipital area, make sure that she can hear this. Can you hear this?
Yes.
And then go ahead and tell me when it stops.
No.
Okay. And assess for air conduction and tell me when it stops.
No.
Okay. So when we assess for air and bone conduction, our air conduction should be twice as long as our bone conduction, just to as far as our sensory ability. Now we're going to assess her TMJ, and so I'm going to have you open your mouth and then close it. Any popping or anything like that? I don't feel any popping. Is it painful at all? Okay. And we're going to assess her mouth. Okay. So we're going to have her just smile for me. We're going to look at her dentition. Okay. Open your mouth real wide. Okay. We're checking out the cheeks, looking, make sure all the teeth are appropriate, looking for any sores on the hard and soft palate. Can you spit your tongue out and say ah? Okay, we're looking at the tonsils. We're looking at the back of the mouth, making sure that there's no redness, any cobblestoning, any drainage that's inappropriate. Let's go ahead and look at the sides of the tongue. Okay, we're looking for any lesions, okay, of the tongue to make sure there's no cancer or anything like that. And we're also going to check and make sure that the gag reflex is appropriate with her. And so I'm going to have you open your mouth. Okay, that's my favorite part of the exam. We're done, right? I wish. Okay, so and we're going to go ahead and move forward. As we can see that the gag reflex was appropriate. We're going to go ahead and assess the lymph nodes. And so we're going to assess the preauricular lymph nodes, and then the postauricular lymph nodes, and the occipital lymph nodes, the tonsillar, the submandibular and submental lymph nodes, the superficial cervical, the posterior cervical chain, and then the deep cervical chain, the subclavicular chain, and then we'd also just have the patient lift their arms and we'd assess the axillary chain. Not feeling anything. If you ever feel anything in the subclavicular chain, you need to make sure that that's checked out appropriately because that's high potential for any cancer or anything like that. So at this point, we're going to go ahead and assess the neck. So as we assess the neck, we want to make sure that the symmetry is appropriate, that there's nothing wrong with the skin, no lesions, tenderness, or anything along those lines. I want to go ahead and feel here. Go ahead and swallow for me. That way we can assess the thyroid and make sure that the trachea, everything is midline. Again, so the patient swallow, there's no pain. We're also going to check the carotid arteries. We're going to listen to the carotid arteries. We're going to palpate those as well. And then we're going to listen for any bruits, any thrills, anything that, again, might be inappropriate for our assessment. So it's just very good, strong pulses up here. Okay, as we assess our carotid arteries, we just want to make sure that our patient holds their breath so that we can listen. And we would listen with the bell of our stethoscope. I actually don't have a bell on my stethoscope, so what I do is I just push a little harder. Again, I don't want to cut off the airway. Okay, and there's no concerns there with our patient. Okay, at this point, we would go ahead and have her lift her shoulders. Okay, is there any concerns there? We're going to do it with Go ahead and lift your shoulders, a little resistance. I'm going to go through a couple of neck movements. We want to check the range of motion of your neck. Can you go like this? Okay, move forward, touch your chin to your chest. Okay, and then turn your head like this, and then like this, and then ear to your, and then other ear to your shoulder. Great job. So now we're going to do some resistance. Turn your head this way. Okay, other way. Okay, head back, head forward. Okay, ear to your shoulder, other ear to your shoulder. Okay. No concerns there. Just making sure that everything, all the musculature is working appropriately. Okay. You see, it looks like I think I've got everything so far. Making sure that I'm not missing anything as we keep going here. At this point, I would go ahead and assess the musculature of her arms. We want to make sure that there's no atrophy. We would check out the hair distribution on her arms, and we would check out her fingers, looking for that capillary refill that is, we want it to be less than 3. We can also assess the brachial pulses and the radial pulses. Okay, and those are appropriate. We would also assess the reflexes. So just have the patient relax their arm down. Okay, I'm going to move to this side. Sorry, I'm kind of in the way. Okay, and then we would assess the reflexes of the wrist there. Okay. Next we would move to the lungs, and I'm going to actually have you turn to the side. We're going to look at the posterior of her chest. And can we have you turn just a little bit more? Sorry about that. Are you comfortable? You don't feel like you're going to fall off? Okay, so we're going to inspect the skin of the chest and make sure everything is appropriate, that there's no concerns, any problems there. And then we'll go ahead and listen to her chest. We're also going to inspect for tactile fremitus. We're going to inspect her diaphragmatic excursion and make sure everything's appropriate. So I'm going to have you say 99.
99. 99. 99.
Great job. Okay. Breathe in deep for me. Okay, great job. What I'll do at this point is we're actually going to make sure that the symmetry of as she breathes in is appropriate. So we would just take our hands and we would put them here on the kind of the lower area of the back and just have her take a deep breath. Okay, and we're just wanting to see our fingers or our thumbs kind of pull out towards the outward, the lateral area of the chest, and that it's doing that evenly. Now we would check for diaphragmatic excursion. Okay, we'd make a mark here, then we'd start down here. And then we'd make a mark here. And we do this bilaterally. We want to make sure that we're about 3 to 5 centimeters difference on both lungs to check for that diaphragmatic excursion. We also need to check the lateral aspects of the chest. We're going to have her raise her arms. And we're going to check for make sure the breathing is appropriate, so breathe deep, please. Okay, and then while I'm here and she's doing this, we're actually just going to percuss as well. Okay, go ahead and put your arms down. And have you go ahead and turn around. Okay, so what we did here on the back, we actually need to do on the front as well. We just need to make sure that we're listening systematically back and forth, checking out both lungs and making sure we're doing some comparisons. Again, checking out the skin, making sure that everything's appropriate, there's no lesions. And we'd also want to be looking at all the moles, freckles that they have to make sure that there's no cancerous spots. And then that if there are, that we can make sure that we get those addressed. So I'm going to have you take a deep breath for me. Okay. So at this point, we would go ahead and listen to the heart and find out if there's any concerns with the heart. Again, I'm going to actually have her sit forward just a little bit. We're going to feel that point of proximal impulse. Sometimes the breast tissue is in the way. You need to make sure that you lift that up so that you can feel that point. Just have the patient lean forward just a bit. Okay, we're going to have them sit back. And we're going to listen to the 5 points of the heart. We're going to listen to the pulmonic area, the aortic, the tricuspid, Erb's point, the mitral. Okay, you're looking for those S1, S2 sounds. We're also looking for any differentials as far as, or any problems as far as rubs, gallops, anything along those lines, and murmurs. Again, if you find those things, you need to make sure that you look into them further, possibly ordering some tests to find out exactly what's going on. We're going to have the patient lay back at this point on the exam table. And we're going to assess her stomach. So as we assess the patient's stomach, and I wish I could bring this closer, but it's attached to the wall, it's all plugged in. Again, we're going to inspect the patient's stomach, and I'm going to actually, well, she's got something on underneath. So normally we would make sure that we want to assess the skin, checking for any lesions, any cancerous spots, any tenderness that the patient can tell us about. And then we want to make sure that the musculature is appropriate. Also, can you lift your head for me? So we're looking for, want to make sure there's no herniation. Go ahead and put your head back. And then we're going to actually auscultate instead of palpate, because we don't want to disturb any of the digestive action at this point. We want to just make sure we're listening to it. Okay, and then sometimes you need to take 2 to 5 minutes if they're hypoactive in each quadrant to make sure that there is something going on, and if there's not, ask the patient if that's a normal response or not a normal response. Then we would assess the patient's liver borders and the splenic borders, and we would do that through percussion. Okay, we just want to make sure we're doing a soft palpation, checking those borders out. We really shouldn't hear a whole lot in the spleen area or in the liver area unless they're inflamed. We can go ahead and do a little bit deeper palpation, try to feel for that spleen. If it's up, we can feel for the kidney. Okay, and then just grab kind of the back here and do the same thing. A little bit deeper palpation to feel for the liver borders. Okay, any concerns there? Any discomfort? We also want to feel for the aortic artery. Listen for any bruits as we listen to that. We auscultate for that. Any thrills? Want to listen to the renal arteries, both the left and the right. Okay, the iliac arteries, both the left and the right. And then the femoral arteries, both the left and the right. Okay, not hearing any concerns there. I'm going to have you sit up. Okay, we'll also assess her costovertebral angle. This is at the back. I'm just going to have you move to the side here so we can just go ahead and show everybody. Just right here, you can feel a little bit softer tissue. And we want to assess if there's any pyelonephritis, anything along those lines that might be inappropriate that we need to have checked out. The patient gets that addressed right away. And a lot of times we just take our hand and just do this. We don't want to swing and hit them real hard. We just want to do a light touch here. If they're truly swollen back there, they're going to jump through the ceiling. So let's just make sure that we're appropriate as we're doing that. At this point, we would go ahead and assess the musculature of the legs, making sure that the hair distribution is appropriate, that there's no lesions on the skin, no pain, any tenderness, bruising, things like that just might not be right. We want to assess the popliteal pulses here behind the knees, the pedal pulses, and the tibial. Okay, we're also looking for any edema. We're looking for any temperature changes of the skin, making sure that everything's appropriate, the hair distribution, and so on. We'll also assess her reflexes. And relax. In fact, can you scoot that way just a little bit more? Okay. Actually, just forward just a little bit. I'm sorry. Okay. And then we're going to go ahead and assess the Achilles. And again on this side. Okay. At this point, we would have the patient stand up. Okay. I'm going to just have you move this out of the way so you don't hurt yourself. I'm going to have you bend down and get as close to your toes as you can. And we want to just assess the curvature of the spine, make sure there's any lordosis, kyphosis, lateral curvature, or anything like that, assessing for scoliosis. At this point, this is the end of my exam today. Thank you for watching.